If you're a runner struggling with hip pain and you don't know what to do, it's not getting better, I'm going to talk you through some of the best ways that we can get rid of hip pain, talk you through the nature of hip pain, what types of hip pain exist, and give you a bit of a plan of how you can get better. My name's Ed. I run a physio practice in Southwest London, specialising in treating running injuries. Now, let's get started. The hip pain is bothering you. Perhaps it's stopping you running. Perhaps it's stopping you being able to run past a certain point. So you get to 5K and you just can't go any past that because the hip starts to hurt. Maybe it's got so bad that sitting hurts, turning over in bed hurts. Every time you stand up after sitting for a while, it gets really stiff and you have to kind of limp around the office or wherever you work and feel like you kind of need to almost loosen up when you take your first few steps. These are all really, really common problems when you're a runner with hip pain. And the first most important thing to think about is that it is an injury that does get better. With treatment, with time, this is a very, very treatable problem. The different types of hip pain that exist include GTPS, or Greater Trochanteric Pain Syndrome, which is pain on the outside of the hip. And that's where we think there's a tendon that lives on the outside of the hip, which is getting irritated and is giving you pain on the outside of the hip. So often people will find they don't like sitting with that problem. They find laying on that side is painful. They also find, it's very, very sensitive to touch. Being on your feet for long periods of time tends to hurt. Also, when you're running, it tends to feel quite bad at the start and then sort of warms up. And then after the run, that's when you start to think, okay, wow, I've done way too much and it's quite sore, and particularly the next day as well. So that would be one type of hip pain that exists. Another kind of hip pain is some sort of labral irritation or femoral acetabular impingement where the labrum is getting irritated. Now, the labrum is basically, we've got a hip, which is a ball and socket joint. So the ball part is called the femoral head and the socket part is called the acetabulum. And at the front of the acetabulum is a lip of ligament called the labrum. The labrum is really good because it gives your hip a bit of extra stability and congruency, and it creates almost like a bit of like a sucker around the ball part of the ball and socket joint. There's lots of benefits. But what can happen with running is the labrum gets put under a certain amount of strain and pressure and stress. If it gets put under so much stress that it gets angry, then we can end up with either a labral tear or some sort of labral irritation. And this is the kind of problem which would behave similarly to GTPS, but the pain will be in a different location. So it tends to be deep inside the front of the hip, sometimes referring it to the groin. It can refer into the kind of side and it's the back of your hip, but it tends to be more at the front. People describe this problem as more of a catching, pinching, stabbing type of pain. It's not going to like flexion. So that means with the knee coming up into your chest. It's not going to like things like deep rotation. So when we're twisting, you may feel like there's some sensitivity there. And there's also going to be similar kind of times when you feel pain as the GTPS. So things like climbing stairs, if it's really bad, turning over in bed, sitting to standing after sitting for long periods of time. It can be a very problematic injury to have, both in day-to-day life, but also as an injury as well for a runner, but also in runners as well. The third most common hip type of problem that we see in runners is what we would call a high hamstring tendinopathy. Now, this is where the hamstring tendon becomes irritated and angry, and it's going to be very localized in the back of the hip, right into almost the buttock. It's going to be difficult with sitting, difficult with running. So you're going to find that it feels sensitive at the start of a run and then sort of warms up and kind of calms down. And then after the run, it will flare back up. And you'll find that the next day it's more sensitive as well. So we tend to find there's that morning stiffness, morning kind of reaction. Also, things like being on your feet for long periods of time can be sensitive as well. Notice that I haven't mentioned a hip flexor strain. A hip flexor strain or tendinopathy are much more unusual in runners. Whereas, if you go on YouTube and Instagram and other social media platforms, people talk about hip flexor pain all the time. And actually, it's very rare that we see a hip flexor problem in runners. And just pointing to where the area hurts and saying that muscle is there, so it must be that muscle, isn't a good way to diagnose hip pain. So the most important thing, if we're treating hip pain, we need to know what we're dealing with. Now, what's also important to understand as a runner with hip pain is that the majority of the strategies you need to use to get better are rehab based. So hands-on treatment will feel good. The hands-on treatment will make it feel like you're getting some quick wins, but actually rehabilitation, exercise, strengthening, training are going to be the things that make the difference. Because I've said it on other videos, if the maximum your hip can tolerate is here, you need to be able to run a half marathon, which is this much effort for the hip. No amount of massage is going to increase how much the hip can tolerate up to being able to run a half marathon. Whereas rehabilitation, strengthening, training, proprioceptive work, endurance work, control work will incrementally over time increase how much the hip can tolerate up to a level where you can tolerate doing a half marathon distance. So hands-on treatment we use in the clinic in what we call step 2. Now, step 2 is where we're trying to calm symptoms down. We're trying to calm the pain down, make things like sitting more comfortable, sleeping, sitting to standing, walking about more comfortable. And it does work quite nicely in those stages when we're just calming the pain down. So we may use acupuncture, dry needling, some shockwave, massage, maybe something that we sometimes use as well. Something else that's really important to understand about hip pain in runners is that it does take quite a long time. Now, I'll go into why that is in a moment, but it's important to understand that it's not an injury that recovers dramatically fast. It tends to be what we call a sawtooth road to recovery. So we see this kind of up and down nature of the problem, and we do get there eventually, but often there's flare-ups, and that's something else I wanted to mention, that we can kind of make a lot of progress, and then something happens where we just feel a reaction. We do a bit more than we can tolerate because we're feeling more confident, and that can sometimes just set the pain back and set people back, and then we're kind of back up again, making more progress. I would say it's very, very normal. I would say it's unusual to get someone from injured back to running without any flare-ups at all, just because of the nature of the unpredictability of knowing how much the hip can tolerate. So often what happens is people feel better and they think, hang on a minute, I feel like I could do 5K here. And their 5K pace is pretty fast, and they haven't understood the benefits of running slower. They kind of absolutely go for it. They get a rush of blood to the head, they get excited, and then the hip flares up. Sometimes it's not even something as big as that. It can be, I went out all weekends, all night on Friday night. I walked around the city all day Saturday, and then Sunday I was just sat on my sofa for the whole day, and now it's really, really sore. So sometimes it could be just a kind of radical change in what someone's doing that really sensitizes the hip. It does take time. We're talking 3 to 6 months, and it can be sometimes longer as well. And it's because the hip is a very, very mobile joint, so it can move in 3 planes of movement. So we've got the transverse plane, it can move into the frontal plane, so it can go into kind of leg going out to the side, leg kind of coming across your body, and then it can also go into flexion and extension. So we've got lots of movements it can do. There's lots of ways that we can irritate the hip, basically, and that can be quite frustrating as a patient for a patient. But if you know that that's what you're dealing with and you can kind of accept it, then you can just focus your energy on doing the right things so you can get there faster. The ways in which we see people accelerate their recovery tends to be those who are very, very diligent at doing their rehab and their kind of home exercise program, those who are very, very good at following advice and not overdoing things and minimizing the chance of problem flaring up. And then the third one is those who get very, very good sleep, rest and recovery. The opposite would be someone who's works 70 hours a week, goes out all weekends, barely has any time to do their rehab. They tend to be the ones that it gets better, but it just takes a lot longer. Now, I've already talked a little bit about stretching, and I wanted to kind of make this clear. It's very, very rare that we'll give someone hip stretches for any of the problems that I described earlier. Not because they're bad, not because they're dangerous, but because apart from some short-term pain relief, they're not going to be the things that make the problem better. Patients tend to feel better, or they feel like they're a bit more relaxed, or they maybe have a little bit less pain after doing stretches. If we're looking at getting someone back to running, stretching isn't going to be the way we do it. So I had someone recently who came in. We'd had about a year of physio somewhere else, loads of hands-on, loads of acupuncture, loads of needles. And then he showed me the rehab program, and it was just stretches. It was abundantly clear why he hadn't got better, because of the things I talked about earlier. Stretching will not increase how much your hip can tolerate up to a level that you can tolerate running again. So we need more strength, we need plyometric capacity, we need endurance, control. We never get any of those things from doing stretches. So I'm not saying that it's bad, but the biggest bang for your buck, the biggest return on investment is more strength-based, more challenging types of rehab, basically, that I've talked about there. And that's probably my final point, that when we're rehabilitating a hip problem, we tend to go through these different steps. So step one is, what we call the kind of goal setting sessions, so the initial session. Step two is when someone's in daily pain. So they're struggling with climbing the stairs, struggling with sitting for long periods, struggling with sleeping. And in that phase, we'll use hands-on treatment and stretches perhaps, if we get, some quick wins with just feeling better in that moment. And once we're getting some pain relief, we're getting on top of those short-term daily symptoms, then we're moving into stage 3, which is where we're treating the root cause. Now, this is where we're doing more rehabilitation in the gym. So we might start off with some isometrics, some holding exercises to get lots of time and attention. And we're also going to get a bit of pain relief for that as well. And we're going to increase the muscle tone in that area as well. So that might be where we start. Then we might progress to some heavy, slow resistance training, where we're loading the glutes, the groin muscles, the hamstrings, the quads, and the hip abductors. That will be where we start to think about introducing some plyometrics. Now, plyometrics I really, really like for hip pain. They're a huge part of how we get people from step 3 to step 4, which is going back to thoughtless, fearless movement. And that's where we're going to be doing a battery of tests to see if we're ready to go on to stage 4, which is basically returning back to running. So we're going to be doing some stress tests. We're going to be comparing the left side to the right side. We're going to be doing some return to running, 5 minutes on the treadmill, 10 minutes on the treadmill, maybe longer. And we're using those data points to say, this is ready, this is solid, or no, we need to spend a bit more time in step 3. And then step 5 is prevent and protect. And that's where our patients are back to running. We're keeping on educating them about how this injury started, and often it's a training error. We're trying to educate them to a point where they just are able to keep themselves in check. There's always more work we can do in terms of rehabilitation. And obviously it gets to a point where strength and conditioning can increase performance and improve performance. So there's huge scope to be able to help someone just continually build up their load tolerance. And that will be how we would treat this kind of problem, basically. Shockwave treatment is something we use for GTPS sometimes, which is that pain on the side of the hip. And similarly for high hamstring tendinopathy, because shockwave treatment can be quite useful for those early stages when we're trying to get on top of the pain in the tendon. So check out my recent video on hip pain, where I talk about the mistakes that you should avoid when trying to treat hip pain. Thanks for watching, and I'll see you on the next video.